Hello, my name is Margaret Richardson and I'm making this video on World Hepatitis Day to raise awareness and most importantly to discuss prevention. I'm a member of the We Give All Hepatitis Awareness Foundation, which was set up by Mrs. Zainab Zenazi some years back. I'm also a healthcare professional. So let's begin. What is hepatitis? It's an inflammation of the liver that is caused by a variety of infectious viruses and non-infectious agents, leading to a range of health problems, some of which can be fatal. There are four main types A, B, C, D and D. And while they all cause liver disease, they do differ in important ways, including modes of transmission, severity of the illness, geographical distribution. It is very high in parts of Africa, particularly Sierra Leone, Asia, and it is here in the UK. There are preventative measures which I will discuss in a short while. But in particular, hepatitis B and C lead to chronic disease in hundreds of millions of people, and together are the most common cause of liver cirrhosis, liver cancer and viral hepatitis related deaths. The charity focuses mainly on hepatitis B because it is, as I said, preventable. There is a vaccine which is 99% effective. But it's really important that you get tested in order to know that. So it is potentially, as already stated, hepatitis B is life-threatening. It is caused by the hepatitis B virus, HBV. It is a major global health problem. It can cause chronic infection and puts people at high risk of death from cirrhosis and liver cancer. If contracted as an adult, some can build immunity to it within the first 6 months, which is known as acute hepatitis. However, in children, it can be chronic, without you even knowing your child has the disease. It can last a lifetime with possible serious liver damage over time. So what are the symptoms? The symptoms can be very similar to other conditions, so that's why it's so important to get tested if you have any of these symptoms. The other diseases such as malaria and typhoid present in a very similar way. And that is fever, aches, pains, tiredness, abdominal pain, poor appetite, diarrhea, nausea, vomiting, yellow skin and yellow eyes, which we call jaundice. How is it spread? Well, it can be spread from an infected mother's blood to the baby during childbirth, from children to children in the playground, if there's an accident involving blood, using non-sterile equipment for piercing, tattoos, needles, sharing toothbrushes, having sex with an infected partner without condoms and being transfused with an infected blood. However, in the UK, all bloods now are tested for a variety of conditions prior to them being transfused. As already stated, if not treated, it can lead to fibrosis, cirrhosis and cancer. Diagnosis and treatment. Because, as I said already, hepatitis symptoms can be similar to those of malaria and typhoid, you need to get a blood test for hepatitis. It's the only way to find out. Treatment and management will depend on the stage, but the most important thing is prevention. There is a vaccine available which is 99% effective. Practice using safe sex. In other words, if you're having sex with multiple partners, use condoms. Do not share toothbrushes. Use clean needles if you are drug dependent. If you're having a tattoo or a piercing, make sure that the equipment or the instruments being used are sterile. Do contact your doctor or call us for advice on 0044 7570 193 591. Thank you very much for listening.